CEN Mock Exam YouTube. Question 1. A patient with a history of asthma presents with respiratory distress, minimal air movement, and an absent wheeze. This finding indicates the patient is improving. A silent chest, indicating severe bronchospasm. A pneumothorax. The patient needs a bronchodilator. Question 2. The nurse is performing a secondary assessment on a trauma patient and notes a GCS of 12, a respiratory rate of 30, and an SpO2 of 89% on room air. The nurse should apply oxygen and prepare for intubation. Complete the secondary survey before intervening. Place the patient in a high Fowler's position. Administer naloxone. Question 3. A previously healthy patient presents with acute onset of shortness of breath, hypoxia, and normal chest X-ray. The nurse's primary differential diagnosis is pulmonary embolism, asthma, pneumothorax, myocardial infarction. Question 4. A patient presents with hematemesis and melena. The nurse's priority is insert a nasogastric tube, administer oral vitamin K, establish 2 large-bore 4 lines, and administer fluids. Prepare the patient for an endoscopy. Question 5. A patient presents with sudden onset of severe, diffuse abdominal pain, vomiting, and a history of alcohol use disorder. The nurse anticipates an order for NG tube placement, serum amylase and lipase, abdominal CT, all of the above. Question 6. A 64-year-old male presents with crushing substernal chest pain radiating to his jaw and left arm. He is diaphoretic and nauseated. His ECG shows ST segment elevation in leads V1, V4. The nurse anticipates an order for aspirin 324 mg chewable, morphine sulfate 4 mg for push, nitroglycerin 0.4 mg sublingual, all of the above. Question 7. Following blunt chest trauma, a patient has absent breath sounds on the left, tracheal deviation to the right, and hypotension. The nurse suspects massive hemothorax, tension pneumothorax, simple pneumothorax, cardiac tamponade. Question 8. A 28-year-old female presents with lower abdominal pain and vaginal bleeding. She is 8 weeks pregnant. The nurse suspects appendicitis, ectopic pregnancy, pelvic inflammatory disease, ovarian cyst rupture. Question 9. A patient with pelvic inflammatory disease is being discharged. Which statement indicates the patient understands the discharge instructions? Getting pregnant shouldn't be a problem once the infection goes away. I'll take the medicine for nausea when I feel sick to my stomach. I will be at increased risk for ectopic pregnancy. I will follow up with my doctor tomorrow. Question 10. A family member of a patient in cardiac arrest insists that everything be done to save the patient, despite the patient's living while declining aggressive measures. The nurse should follow the family's wishes. Continue CPR until the physician clarifies the advance directive. Stop CPR immediately and contact risk management. Ask the patient what they want. Question 11. A patient presents with fever, chills, and a productive cough with rust-colored sputum. The nurse recognizes this as consistent with viral pneumonia, mycoplasma pneumonia, pneumococcal pneumonia, tuberculosis. Question 12. A patient presents after a house fire with dyspnea, sooty sputum, and a brassy cough. The priority nursing diagnosis is fluid volume deficit, impaired gas exchange, ineffective airway clearance, pain. Question 13. A state senator is being treated in the ED and a staff member discusses his care with a local reporter. The facility is most likely to face a lawsuit for false imprisonment, defamation, libel, invasion of privacy. Question 14. A patient presents with a sickle cell crisis and reports severe pain. The nurse should encourage oral fluid intake, administer a non-steroidal anti-inflammatory drug, administer opioids as ordered, apply a cold compress to the area. Question 15. A patient with third-degree complete heart block is bradycardic and hypotensive. The nurse should anticipate atropine 0.5 milligrams for push, transcutaneous pacing, adenosine 6 milligrams rapid for push, amiodarone 150 milligrams for. Question 16. Which laboratory value is most specific for acute myocardial infarction? CEN, myoglobin, troponin I, BNP. Question 17. A 2-year-old child presents with a barking cough, stridor, and respiratory distress. The nurse suspects epiglottitis, croup, foreign body aspiration, asthma. Question 18. After a fall, a patient on warfarin is found to have a subdural hematoma on CT. The nurse anticipates administering clopidogrel, vitamin K, fresh frozen plasma, both B and C. Question 19. A patient presents with right upper quadrant pain radiating to the shoulder, fever, and jaundice. The nurse suspects acute pancreatitis, acute cholecystitis, bowel obstruction, perforated peptic ulcer. Question 20. A patient with a terminal illness requests a do not resuscitate order. The nurse's role is to encourage the patient to discuss this with their family, notify the physician, and support the patient's decision. Refuse to care for the patient. Contact the hospital ethics committee.